I love how you're taking data from all of these different sources, looking to help solve some of the most urgent current problems around GLP-1s and the rising cost of healthcare, but also making sure that access, accessibility, and equity to care as personalizing care. And I think the thing that everybody's going to love from this, giving doctors more time and reducing prior authorizations. Hello, and welcome to the Glow Up, fabulous conversations with innovative minds. Today, I'm talking with two innovators from Avalon Healthcare Solutions. We've got Julie Schulz, VP of Product, and Mike Dovidio, PharmD Product Manager. Julie and Mike, thank you for joining me.
Happy to be here.
Yeah, thanks for having us.
Awesome. Julie, let's start with you. Can you introduce yourself a little bit and tell us what you do in your role at Avalon Healthcare Solutions?
Absolutely. So my name's Julie Schultz. I'm a VP of Product at Avalon. I oversee our lab values management portfolio, where we are taking lab values data and really trying to help improve both the quality and cost effectiveness of care, especially as it pertains to the laboratory space and the decisions that providers make about labs. I'm personally a physician by education. I have an MD and MPH from Northwestern University, but I actually never practiced. I went directly into consulting and tech, really working to find the solutions, both analytical and technological, that are going to help improve healthcare.
Love this. You are not the first person I've met who has gone all the way to get that to become a doctor and then decide to use that information in a different way. So I can't wait to dive in more.
Awesome.
And when you talk about lab values, the Glow Up audience is very interested in innovation, but doesn't necessarily know healthcare terms. Can you describe a little bit what you mean by using lab values to impact the care chain?
Absolutely. So when you go to the doctor, you have your blood drawn. They're going to do some basic labs that test different biomarkers in your system to assess your overall health. I think we're used to some of the routine things, whether it's like your lipid panel, maybe your sugars, your hemoglobin A1C, that help kind of look at cardiometabolic health and cardiovascular disease, diabetes. Increasingly, we are looking more and more at genetic lab tests. So looking at both the set of genes that you're born with, but also potentially the set of genes that are causing a tumor or cancer genomics. And that is really an area of precision medicine and tailored individualized medicine that's exploding right now.
Okay, I just heard a couple things that we need to come back to. We got genetically personalized medicine. I heard some hints at like the GLP-1 conversation, and there's some other juicy stuff in there. Let's turn to Mike Dovidio. Mike, can you share what you're doing at Avalon and a little bit of how you got there?
Yeah, sure. So my name is Mike Dovidio. I'm a pharmacist by trade. With Avalon, I am a product manager and I oversee our specialty pharmacy solution, which really helps health plans better manage their spend in the specialty pharmacy space. These types of drugs are typically not the ones that would get dispensed at a normal retail pharmacy. They're more so the infusion meds that you would go to an infusion center or something like that for. As a pharmacist, I started out working at everyone's favorite three-letter pharmacy. From there, moved into general management, where I took over as general manager of a pharmacy in St. Petersburg, Florida, and then moved into more of the tech space. I've always been a bit of a techie and interested in emerging technology. So I started with a digital pharmacy startup and I actually launched the market in Tampa Bay as a general manager. And that's really how I got familiar with what a product organization is and how a product manager operates within a company. And decided to pursue that as the secondary track of my career.
The way you called out this like becoming aware of the product role and like the product work and innovation coming from a healthcare background, made me just very curious. How familiar would you say in healthcare organizations is that sort of role and place of a product owner, a product innovator? Is that something that you have to introduce, or is it generally well adapted in that sort of? I'm coming from like a startup perspective, so I'm very curious if those worlds treat the idea the same way.
I think product manager is a pretty well-known term in
Okay.
healthcare nowadays. I would say that health insurers probably think about companies like Avalon, not so much like innovators, but more like vendors and the
Mhm.
solutions that we offer. I think it's familiar enough in the industry right now. I don't know that if you asked a healthcare executive what a product manager is, if they could give you the agile definition of what a product manager does. But I think it's well known enough that when a health plan needs to reach out to Avalon for something like specialty pharmacy or LVM services, they kind of know this is Mike and this is Joy.
Got it. Thank you for that. That's a great example of my squirrel moment. So there's a bunch of interesting things that both of you've mentioned. When I was at the health conference recently, something that was really notable, and it seems like you are working right in this space, was that challenges on the workforce, improvements in innovation, comfort, and familiarity with electronic health records has kind of made a little bit of a change of moving from like all care has to be in a room with a doctor to many players within that the whole ecosystem of healthcare can contribute insights, can contribute great advice, can help personalize care and make it more effective. This seems like where you're using labs and pharma data to really drive value for your customers. Can you talk more about this problem space that you're like, how you're approaching data, labs, and how you're impacting that care chain?
Yeah, absolutely. I think you covered it well, just the complexity of healthcare, but also the strain that a lot of providers feel, but also employers are strapped to provide coverage for their employees, and that can be very expensive, especially given the rise of GLP-1 or the Ozempic types of medications. As all of that is coming together, what we do is really recognize that there's an opportunity to better support providers in terms of making the best evidence-based decisions for their patients. I mentioned earlier that laboratory medicine, particularly genetics, is just exploding. It's impossible for physicians to keep up with everything that's changing, and the complexity of patients continues to explode. And so, how can we put tools in front of them that help make the best decisions for their patients according to the evidence, the guidelines that are going to lead to the best outcomes, and ultimately be good stewards of the finite healthcare dollars that we have to spend. So we really take all of that information and try to make it as simple as possible for the providers, but also the health plans to understand their patient population, to offer the services and care management types of programs that are most needed by patients.
Amazing. And Mike, you mentioned that you might be the person that these vendors reach out to, these systems and insurers. What are the kinds of questions that they're bringing to you? How do these conversations, these partnerships get started?
Yeah. So, I mean, typically it starts with how can you save us money? Everybody's strapped right now. You see it across basically every industry. But when we think about specifically like GLP 1s, we're already seeing that the sort of pot of dollars that a health insurer has to work with is not enough to cover all of the patients that A are eligible for the drug based on the FDA approval, but B want the drug. There's a lot more patients out there that want the drug that may not have diabetes or, even I would go as far as say aren't obese by definition of what your BMI is. And so we are already starting to see some of these health plans quite literally have to lay off their workforce because they've just gone above and beyond what their budget is for their pharmacy spend. And specifically noting that GLP 1s are a big source of what's sort of pulling those dollars away.
So, if I heard correctly, in the industry, the cost of supporting GLP-1s for even just the folks who deserve it or who qualify for it medically, and if you include the rest of the folks who want it, is straining that care budget to the point where insurers have to lay people off in order to fulfill those insurance obligations.
Exactly. And I would add, if it's okay, patients are suffering as a result of this too, because if you look at North Carolina, for example, they initially offered coverage for weight loss for GLP-1s, but spent $100 million on it, went completely over budget. And now we're in a situation where they can't cover it at all. And so we really need to help find that sort of happy medium of where we can provide coverage to the patients who need it most in a cost-effective manner. But unfortunately, if we let everyone who qualifies for GLP-1s, which given the expanding set of indications could be more than half of the US population, we would completely bust the budget of our healthcare program. So we have to find, there's really a void right now of trying to figure out ways of who we should be giving these drugs to, given that they're so powerful, but also given that we have limited resources.
I think it's important to understand the sort of classical thinking of coverage criteria from an insurer. In this case, it would probably be more so the PBM standpoint, pharmacy benefit manager. When you think about things like obesity, what is the actual criteria that they're using to define obesity? It's usually body mass index. And so, the sort of innovative side of Avalon, how Julie really is starting to think about what can we do with lab values to really level up that thinking of what it means to be like to classify somebody as obesity. It's really starting to use more than just BMI. And I'm sure Julie can talk to this more than I can, but it's using things like your A1C, your blood sugars. There's a variety of other lab tests that get done that kind of paint the picture of what we internally refer to as your cardiometabolic health. Quite honestly, may not line up to your BMI. I mean, I can tell you personally speaking, my BMI is a 32 because I'm not like, in my opinion, I should not have insurance coverage for a GLP-1 because I'm not diabetic and I don't really need to lose weight. I'm just by definition of BMI considered obese.
I'm so glad you brought that up. One of the most universal complaints of patients in the healthcare scenario is I'm being judged or diagnosed on this thing that I don't control, that I have so little, it's just a part of my existence. And so the idea that Julie, and I'm going to turn to you and tell us more, is working on these ways to really make sure that, like, the way I see this is, right, instead of just like a height and weight kind of equation, we're looking at a whole human. We're looking at, like, how is your body actually working? Are you in optimal condition for what you're trying to do? So Julie, how are you able to, it's such a complex ecosystem. How do you approach innovating and moving the needle with this innovative personalized care with so many players? It's kind of a two-part question.
Yeah, so I'll give a little bit of background. Many patients, folks in healthcare are accustomed to, you go to different specialists. You go to an endocrinologist for your diabetes. You go to a cardiologist for your cardiovascular problems. But what we've increasingly learned, and intuitively makes a lot of sense, is that all of these different organ systems really interact with each other. And that's why we were kind of now thinking more about cardio-kidney metabolic syndrome that really encompasses all of the organ systems and all of the downstream diseases that come from this sort of unifying syndromes. And the American Heart Association has recently recognized that as cardio-kidney metabolic syndrome as a sort of unifying theme for how we should be thinking about treating patients. And so that means that doctors who typically might not work together need to better collaborate. That means that cardiometabolic physicians and centers of excellence who really specialize in bringing all of these things together are emerging. And that means that the tools that we use to make clinical decisions about patients need to be more focused on this broader holistic combination of diseases. And fortunately, lab values and biomarkers is exactly how you can measure and track diseases in this category. And so what we've started to do is look at those lab values. So for your hormones, your diabetes, we can look at your glucose and your hemoglobin A1C. For cardiovascular disease, specifically atherosclerotic cardiovascular disease, which causes heart attacks, strokes. We look at your lipid levels, but also some newer biomarkers that can hint at genetic causes of cardiovascular disease, like lipoprotein(a). We also look at kidney function, liver function. We can bring all of these things together to really understand the overall cardio health of a patient that really brings together all of those different organ systems. And because GLP-1s are effectively cardiometabolic drugs now with indications ranging from diabetes, obesity, cardiovascular disease, obstructive sleep apnea, and more are on the horizon, it's really important that we think about all these diseases together and select patients given limited resources using metrics that cover all of those diseases.
There's this very notable tension between these drugs can help a lot of people. We're learning every day there's more people that can be helped. And we can't help all the people with it because it's just too expensive or that it's complicated. It feels like the cost of the drug is really driving a lot of the underlying conversations. And that feels a little backward from my user first perspective. How do you approach a problem like that that seems so big and maybe not in the control of a team like yours or even in the control of the systems that you're working with? I mean, is that a way that we could?
Yeah, I think breaking down problems in healthcare is unique and different from other industries, especially consumer focused industries, because you've got so many different players at the table. I think that, first of all, the way I've always approached this as a product manager is first just understanding the evidence, the guidelines, the clinical background, if you will, because we always want to make sure that we're doing right by patients and following the science. At Avalon, we say science is our true north. Then I look at the workflow and the different players involved and identify those points of tension, those points of friction. Or, for example, our analysis has shown that even though GLP-1s are indicated for diabetic patients, we find that the healthier diabetic patients are 3 times more likely to get a prescription for GLP-1s. And so by creating so much complexity in the system, creating prior authors, the patients with better resources, the patients who go to doctors who have more time, more staff, are going to be the ones more likely to get the medication. So we have to come up with workflows and tools to really change that dynamic and improve health equity, but also to improve the outcomes. If the drugs are going to the sicker patients, we're going to, as a population, see better metrics of improvement.
That was amazing. Thank you for that. That was like the recentering that I so needed. So there's so much to get into here. We've got the problem and like the impact, this value of like, how do we connect the right people with the right care so that we can really up-level the quality of care for everybody is fantastic in such a complicated system. And with such sort of cutting edge technologies in the space, how do you measure the impact of the work?
Mike, you want to take it or you want me to jump in?
No, go ahead, Julie. Why don't you start us off and then I can pull somebody in here.
So at Avalon, we're really lucky that we have access to so many different data sources. That's really our superpower, is to be able to bring together the cost data and the clinical data, and ultimately some of that outcomes data as well. So at the end of the day, we're not naive. We know that in order for us to exist in an organization, for our product to take off, we have to demonstrate some return on investment. And so I think one of our powerful assets is our ability to take all of the different types of claims data, basically all of the different things that happen in a patient's healthcare journey, and be able to measure what the cost of all of that care was, and to measure it over a period of time, tie it to different causes and effects, and be able to really show what potential return on investment could look like for health plans and employers. So that's one piece, and that's kind of a very easy measure of whether we've had impact. But then I also look at other metrics, even looking at, so we mentioned some of the cardiometabolic indices or other biomarkers that can measure a health of a population. Certainly we can track those for health plans or for providers or for employers. But then we can also look at, those gaps in care, those access measures. Our sicker, do we see actually, based on our interventions, the support that we provided to health plans and providers, are we seeing the needle move? Are we seeing more patients who are sicker getting the drugs? If we have race, ethnicity, SOGI data, are we seeing those gaps close in terms of healthcare disparities? All of those things we try to put into our dashboards so that providers and health plans can see at the population level how things are changing, but then dig all the way down into the patient level and see which patients have needs, or which patients are now getting the right care at the right time.
Mike, I want to let you jump in here, but
yeah, sure,
I have to just call out I heard using data to make sure equity and access of care for underserved populations. What a fantastic like impact to know that you can like have, that you have the power to move. Like, bravo.
From my perspective, I think it all starts for me with can we improve patient care? And that can come in a couple different kinds of ways. Number one, obviously, is cost. Can we decrease cost for the patient? Number two, can we decrease patient frustration? And so, is there opportunities to remove some of the barriers that patients and providers typically face along this journey of getting a GLP-1? And can we do it in a way that is sort of automatic using, lab values? And that ultimately boils down to like a timing aspect. I think Julie had sort of closed her point out with making it easier for patients to get the right access of care or making it easier for providers to do the right thing. Well, can we make it faster for patients to get ultimately to the care that they need? Because that's a big, and I want to go back and touch on something that we actually started the conversation with, which is this idea of time crunch and that there are workforce constraints, not just for the providers in the community care offices, but also for the providers in the health insurance plans. I mean, I can't tell you how many plans I've talked to that don't have the time to review everything that they should be reviewing. And so it really, it's not really something that you can just sort of hire more people for. You have to come up with some type of automated solution using emerging technologies that, quite honestly, as a healthcare system, we haven't been doing. And, but we have the ability to be able to do it. It just takes somebody to kind of pull together all these pieces. And that's kind of where Julie and I see Avalon fitting in some of this is we have access to the labs to be able to get the lab values and aggregate that data. And we have access to the health plans to be able to sort of push some of these insights back to them to allow them to make better decision making on their end. But when it really comes down to weight loss and GLP-1s, again, there's also time constraints on the patient, right? We're talking lifestyle changes. We're talking habit changes. It's not just, I'm going to inject myself with this medicine. It's like, I need to commit to a healthy lifestyle, which includes better eating habits, better exercise habits. I mean, there's a lot more that goes into this than just the sort of medications themselves.
Okay, this is lovely because the next question I was hoping to ask was like, how have you learned about your customers, the patients that you worked with, right? And how has that impacted the way that you approach your product, the way that you approach the, and what you're hinting on here is, right, even though we can surface some of this data, there's like other layers that are involved in actually delivering that outcome that everybody's invested in. Can you go into some specifics about like how you've learned about either, these additional layers or how your access to all of this patient data has helped you direct the product and your approach in the industry?
You want to start? You want me to take?
Yeah. Yeah, sure. I was gonna give you some time.
Julie and I have really started to refer to data in the sort of three pillars. There's your medical claim data, which typically comes from your health plan. There's the pharmacy claim data, which typically comes from your PBM, and that's where your GLP-1 sit is with the PBM. And then there's the lab values data, which typically sits with the laboratories themselves. And so we sort of recognize through conversations with different players that we really shine with two out of those three. And the one in particular, lab values, is an area that there's not a lot of other players in the space who are sort of aggregating lab data the way that we are and trying to effectuate changes in care. So, and I guess I'm kind of answering the reverse of your question here. I think what we've realized is that there's sort of unmet opportunity to be able to partner with to actually effectuate something on the pharmacy claim side.
This is amazing. Mike, the idea, right, like to learn about what the market needs, where you are strong, and then how to partner and fill in where that is outside of your core focus is like innovation 101. So like it's like one of those biggest challenges, right, is to understand where you're constrained and where you need help, and to have that clarity based on all this data you've collected. Like, wow. So Julie, it's time to get into the glow up part of the conversation, right? There's a lot of great data. You're working in this like imminent, like very painful of the moment space with a lot of tools. What's the glow up that you see for Avalon and the work that you're doing in the next 6 months? What are some of those goals that you're looking to really impact and actuate?
Absolutely. So as Mike mentioned, we have access to all this data, which makes us unique. But I think we also it's one thing to have the data, and I think we've learned this the hard way in healthcare. Just because it's in an EMR or just because you have the data doesn't mean that you make great use of it. And so again, I always approach things clinically in healthcare, focusing on what are the most important outcome measures, what data do we need to focus on, who are the right data scientists or partners that we can either hire or bring in. We have a fantastic team at Avalon that really helps us make sense of all of this information. And and then making it again, going back to your last question about how we learn about the customer, how we learn about the problem, making sure we really understand the workflow and the pain points of the people who are ultimately going to be the recipients of this data. We're not just going around and asking, physicians, health plans, tell us more about what you think about this, but we're actively putting together prototypes or analyses with the data that we have in house to get their feedback to see how that might change their behavior, to make them think about a problem in a way that maybe they hadn't thought about it before, especially since we know a lot of them don't have this data. So we might be bringing insights for the first time. So constantly interacting with customers with the insights and the products that we're building really helps kind of fuel that cycle. And I hope that in 6 months, we've actually helped, move the needle for a client. We're starting to work with some health plans on GLP-1s, and I'd love to actually see some of those metrics that we talked about, whether that's health equity, whether that's hemoglobin A1C levels, whether that's even it probably won't see it in 6 months, but in 1 to 2 years, how has that affected cost? How has that affected emergency room visits, overall total, yeah, cost of care, or other types of high cost things like hospitalizations or amputations, for example. Those are things that we would really want to see change.
That's amazing. Thank you so much. Mike, kind of tagging along, from your perspective, how do you know that the work you're doing at Avalon, that you've made it, that you've hit that goal?
It's always challenging to know if you're actually, we're on the forefront of some of these innovative products. So it's hard to know early on if you've actually like done anything. I think one of the ways that, in my personal opinion, that I know that we've made it is just in my conversations, and I'm an experience here. I know that I'm in a position to really impact care when I talk to some of the pharmacy executives and explain to them like, look, this is tactically how I think we can reduce your PA volume, your prior authorization volume, but also here is the actual number of prior auths that I think I can reduce in your workload, and can boil that down to a sort of number of full-time employees. And I think I know that it's successful when I get their reaction and they're just so excited to have something tangible that, can actually impact their teams and the work that they're doing. You know, and I'm quite honestly honored to be, as a pharmacist, to be in a position to actually be able to decrease prior authorizations for the industry, because I can tell you firsthand, they are not fun to deal with from a provider perspective, from a pharmacist perspective, and probably most importantly, from a patient.
If you can reduce prior authorizations, Mike, you're gonna be my biggest hero. Oh my
Regardless,
goodness. What a fantastic North Star. I mean, several fantastic North Stars in here. I'm having too much fun. You two are amazing, busy professionals. So, as we start to wrap up, is there anything that you're looking for? Do you have a CTA for the community, and how can folks get in touch?
So I think we want to talk to everyone. I think that's a key part of innovation is just to have as many conversations as you can. So don't hesitate to reach out if you have questions or want to continue the conversation or want to get some thoughts on your own programs. Really, looking for all conversations and all types of partners in this journey. I think you probably have our contact information at julie.schulz@avalonhcs.com is my email. So I'd love to hear from and continue this conversation. Mike, how should folks get in touch with you?
Yeah, I'll just echo what Julie said. I mean, we want to talk to everybody and anybody that we can. So the more input we can get from the industry, that really helps us in our position to really develop a product that's going to work. Not just something that we think is a good idea, but something that will actually be impactful out into the industry. That's ultimately what we're trying to do is impact the industry. But so yeah, as Julie said, you can get in touch with me. My email, michael.dovidio@avalonhcs.com. Or if you just go to avalonhcs.com, there's a contact us link.
Amazing. Julian, Mike, it has been so good to chat with you. I love how you're taking data from all of these different sources, looking to help solve some of the most urgent current problems around GLP-1s and the rising cost of healthcare, but also making sure that access, accessibility, and equity to care as personalizing care. And I think the thing that everybody's going to love from this, giving doctors more time and reducing prior authorizations. It has been so fantastic to talk with you on the Glow Up. Thank you.
Thank you.
Thanks, David.